Today we are going to practice somatic tracking, a method of calming the nervous system by sending the body messages of safety to turn down the volume on chronic pain. This exercise can be done sitting or lying down, any way that will allow you to close your eyes and enter a spirit of gentle curiosity about the sensations that are currently in your body. By paying attention with a spirit of gentle curiosity, we can begin to rewire the fear signals in our brain and turn off the pain. To begin, close your eyes and turn your attention to the sensation of your breath as it enters and exits your body. Noticing the breath is the first step to entering a conversation with your nervous system. Take a deep, slow breath, noticing as the lungs expand down into the lower back, filling to their maximum capacity. Hold your breath for a few beats at the top and slowly exhale, noticing the sensations as the lungs return to their normal size. Let's do that one more time. Slow down your breath, breathing in fully, noticing as the lungs expand into the lower chest and back. Pausing at the top and exhaling slowly until you notice the small shift of being inside your body. Now that you have entered your body, notice any sensations that you find there. You can scan your body from the top of your head, down through your shoulders and arms, into your chest and your abdomen, and down through your hips and legs, all the way to the bottoms of your feet. Notice where the strongest sensations arise in your awareness of your body. It is to these sensations that we are going to direct our messages of safety. When we feel a strong physical sensation, we subconsciously label that sensation as pain, which our brains consider to be a danger to us. Research into the science of pain now shows that when we label a sensation as dangerous, we turn up the fear signals in our amygdala, the fear center of our brain. But by sending our brain messages of safety around the physical sensations of our body, we can reduce the fear and calm down our amygdala, which over time will reduce and even eliminate most cases of chronic pain. With a spirit of gentle curiosity, choose one sensation and begin to describe it. Is it spread out or is it sharp? Is it a warm sensation, a cold sensation, or perhaps neutral? Does the sensation move around, or does it stay in the same place? Just notice. By looking at the sensation with a lens of curiosity instead of fear, we begin the process of calming the nervous system. Describing the sensations tells the body that these sensations are safe. They are allowed to be here. We're not trying to get rid of them. We're getting curious about them, describing them using neutral words. If you notice you've gotten distracted by other thoughts, you can simply return to the breath. If you notice any movement, follow it along and keep turning your curious awareness towards these sensations. And if the sensations remain the same, that's perfectly fine. The point of somatic tracking is not to be in a hurry to get rid of the pain, which can often turn up the dial on our fear response. Instead, we're just noticing it and describing it. Your brain can relax because these sensations are safe to feel. Even when they are not bringing you comfort, you are safe to pay attention and to notice these sensations. All sensations are temporary. You are going to be okay. And if your sensations have changed in any way, notice how that is evidence of your brain's ability to change its interpretations of these sensations. It's possible to practice sending your body messages of safety to reduce your experience of pain. Now, open your eyes and return to the world around you. Come back anytime to practice turning down the volume on your fear and living with greater comfort and ease.